Melissa, thank you. Well, some bigger headlines from our federal government on the COVID front this morning. The CDC, as we've been reporting, shortened the time people need to quarantine or isolate, going from 10 days to 5 days. And Dr. Fauci saying maybe we should think about a vaccine mandate also for domestic air travel. All this happening as Omicron variant surges here. So to talk about this, Washington Post breaking news reporter Annabelle Timsit joining us this morning from London. Annabelle, good morning.
Hi, Brian. Good morning. Thanks for having me.
Of course, of course. So, Annabelle, Omicron seems less severe, at least on the surface, than what we're normally been seeing. What's the thinking behind this CDC decision? Was it driven by pressure from business leaders, as we've been hearing, or was it because of the cases are spiking of this variant?
Yeah, so I think, for the first part of your question, which is what drove the change in the rules, the CDC says that it's because they've been sort of convinced by the body of science showing that you are more transmissible for a COVID patient in the early days of having tested positive for the virus. So they've shortened the isolation period to 5 days for asymptomatic cases, saying that you are most transmissible to others in the 1 or 2 days before your symptoms, as well as in the 2 to 3 days afterwards. So that totals up to 5 days, and they're convinced that that will enable people to go back to work and will minimize the disruptions that we've been seeing in society. One example of that is flight cancellations that I heard you talking about on your program earlier. Airlines not having enough staff for planes to take off and for folks to go home for Christmas and for the holidays. So I think that was a big motivation, obviously, behind the change in CDC recommendation as well as the science.
Interesting. Well, Annabelle, Dr. Fauci, and speaking of air travel, he just floated a vaccine mandate idea for domestic flights. Will this happen, you think? How is this going to go from a policy perspective?
Yeah, so I think in general, until a formal change of rules has been announced by the Biden administration or by the CDC, I would sort of hold off on putting too much stock in that, because things change a lot, as we can see, right? A couple of weeks ago, I think we all were feeling pretty okay about this period of the year, and then Omicron came in and sort of disrupted everybody's plans. So, until something is sort of finalized and announced at the federal government level, I think that's when you start to sort of assess, right, the impact of those types of policies.
I guess we'll have to wait and see what happens there. And Annabelle, I know you've been tracking Omicron as it unfolds. You're the breaking news reporter with the focus on U.S. and global events. What makes this variant different from the others that you've been reporting on in terms of global leaders' response to this?
So in some ways it's different, but in others not really, right? It feels, I know time is a bit warped right now, but if folks can recall when the Delta variant first came out, everybody sort of panicked as well. So I think in the initial weeks of a new variant being identified, when we don't have a lot of information, which we're still kind of at that stage, we have more now, but not enough yet. I think policymakers tend to sort of put in place the harshest measures they can because they'd rather be safe than sorry. So that's where we saw, a lot of countries banning flights from Southern Africa, even though, evidence sort of showed that the virus had already spread beyond there. We saw some countries going back into lockdown just to try to mitigate the impact of all these cases on their hospital systems. So, I think in the initial weeks, the reaction is always very strong until people can understand a bit more about the variant and what it means. We're still sort of at a stage where we're trying to figure it out. Like you said, Brian, there's evidence that it's maybe milder especially in young vaccinated folks, but we're still not 100% sure. And Dr. Fauci and all the federal health officials say this a lot. We just still don't know enough yet about how this variant will impact us and will impact our healthcare system to be fully confident about the level of care that we should be having here. So I think it'll take a couple more weeks for policymakers to be sure and to decide either way, either to scale back or to implement harsher restrictions.
All right. Well, Washington Post breaking news reporter Annabelle Timsit, thanks for joining us this morning. We appreciate it.